Welcome to the Robert Carr Memorial Lecture at AIDS2020 Virtual. My name is Marian Torres, and I'm the Executive Director of ICASO. First, let me acknowledge that I live and work on the traditional indigenous territory of the Mississaugas of the Credit River First Nation. Again, welcome. The driving force behind the Robert Carr Research Award is Robert's vision of collaboration between community organizations, academic researchers, and advocates to translate findings from research into tangible policy development and advocacy efforts. The award is announced at the biennial International AIDS Conference, and the winner delivers the Robert Carr Memorial Lecture. The first Memorial Lecture was held in 2012, while the first Research Award in 2014. Partners of the award have changed over the years, and for the 2020 edition, we would like to thank the International AIDS Society and the Center for Public Health and Human Rights at the Johns Hopkins Bloomberg School of Public Health, who together with ICASO partnered to bring you the Robert Carr Research Award and Memorial Lecture. The Robert Carr Research Award includes a piece of one-of-a-kind art piece that is symbolic of Robert's strong advocacy for those living with and affected by HIV, by artist Donovan Fairweather, who was a friend of Robert. Each design that he has developed for the award emphasizes the voice of hope and dedication. Robert is that voice, and his voice still guides us in this struggle. Let me introduce the speaker for today. First, Yolanda Paul from the University of West Indies HIV and AIDS Response Program in Jamaica, and member of the ICASO Board of Directors, will be announcing the winner of the award. Then Sarah L.M. Davis, or Meg, will be speaking about the winning project and the work she has done with them. Meg is an anthropologist and human rights advocate. She works at the Graduate Institute Global Health Center and the Geneva Center for Education and Research in Humanitarian Action. Her new book, The Uncounted: Politics of Data in Global Health, is available at Cambridge University Press. And finally, we will have the Robert Carr Memorial Lecture, delivered by a member of the team in representation of the partnership. To close and have Yolanda announce the winner, let me again thank our partner and the winners, and all of you, for your support and for continuing believing in collaboration between communities and academic research to inform decision-making and policy change.
Welcome to International AIDS Conference 2020. And even though we are living in different times and we can't be face-to-face with each other, it does not take away the joy and the celebration behind us presenting to you the recipients for the Robert Carr Research Award 2020, and of course, hosting and having the Robert Carr Memorial Lecture. My name is Yolanda Paul, and I am from the University of the West Indies HIV and AIDS Response Program in Mona, Jamaica. And I'm also a board member of ICASO. I have been asked on behalf of ICASO, and it is my great pleasure to do so, to bring brief remarks and to present to you this year's recipient of the Robert Carr Research Award. For those of us who knew of Robert and know of Robert's work, we know that it has always been centered around people and community. People and community have always been at the core of Robert's advocacy and all of the work that he has done. The Research Award's vision reflects Robert's vision of collaboration between community organizations, academic researchers, and advocates to advocate and advance human rights-based principles and practices, especially in countries where communities are disproportionately affected by HIV, and communities continue to face discrimination, social rejection, or violence, imprisonment, often by government officials and agencies. The driving force behind the Robert Carr Research Award has and continues to be Robert's commitment to translating findings from research collaborations between community and academic partners into tangible policy development and advocacy efforts. And this year's recipient is particularly special. I can actually see in my mind's eye Robert standing in the corner of the room, smiling from ear to ear as only he can. This year's recipient is an organization to which Robert is because we don't we don't say was, is a co-founder and has worked tirelessly with other colleagues to ensure that it is a coming together of organizations and communities that are most affected within the HIV response. And this organization that is a recipient this year is not just any organization, it's a family to which Robert has dedicated much of his work and his career. It is a great honor for me to tell you that this year's recipient is CVC, Curbing Vulnerable Communities Coalition, and that they have done a joint project with the University of Birmingham, Alabama, and the project is titled Estimation of Key Population Size of Men Who Have Sex with Men, Transgender Women, and Female Sex Workers in the Eastern Caribbean States. And this year, Dr. John Waters is going to receive the award on behalf of the CVC team. So John, CVC team, members from the University of Alabama, we are proud and happy to present you with this award. Hearty congratulations on behalf of ICASO and the Robert Carr family.
Hello, I'm Sarah L.M. Davis, also known as Meg, speaking from Geneva, Switzerland, a place many of you know all too well. And this was supposed to be a celebration. I don't just mean this ceremony, but I mean this week, AIDS2020. We should be celebrating having reached the 90-90-90 targets, the milestones on the road to ending HIV by 2030. Mathematical models showed that these were achievable goals, and the UN General Assembly approved them. But here we are in July 2020, and we have not reached 90-90-90 globally. Why not? You're going to hear, I'm sure, many explanations. And of course, COVID-19 has struck a devastating blow. But before COVID-19, we were also off track. Some say because of lack of adequate financing, others because of lack of political will. They'll say the models were right, the targets were good. It was developing countries that failed. As an anthropologist, when I look at those mathematical models, I see all the things in people that were left uncounted, what Nick Seaver calls the unquantified remainder that haunts math. As the UNAIDS PCB NGO delegation put it a couple weeks ago, and I quote, "The uncounted in the global HIV response include people who use drugs in countries where they face psychiatric wards, if they're counted. Gay men or trans women in countries where torture or state executions or murder in the street face them, if they are counted. Sex workers who face weekends of rape in police stations, if they are counted," and so on. And as my book, The Uncounted, Politics of Data and Global Health, argues, such unquantified realities as stigma, discrimination, and criminalization create a data paradox. Countries negate that key populations exist. So no research is done into their health needs, often, and the lack of data means services that could save their lives are not funded. And the lack of services just reinforces the lack of data. Many countries lack key population size estimates, or they have size estimates that are implausibly small. As a result, my research finds that interventions to meet the needs of small key populations may be judged not cost-effective compared to larger groups. Invisibility and discrimination reinforce one another in a vicious cycle. And a few years ago, as I began this research, I wondered if there was a better way to count key populations. And as it happened, I was at the AIDS conference in Durban, and I heard that Caribbean Vulnerable Communities Coalition, CVC, was planning to do key population size estimates with civil society participation in 6 Eastern Caribbean countries. This was funded by the Global Fund, what they thought might be, at that time, the last Global Fund grant to the region, as many donors have been pulling out of middle-income countries, not a priority anymore. So I asked John Waters of CVC and Henna Budwani of University of Alabama at Birmingham if they would let me come and do a study of their study, and they generously agreed. And that began what in the book I call an epidemiological epic. John is a brilliant researcher, and he's a force of nature who was determined to find and reach hidden subpopulations, such as young men who have sex with men. And despite tropical storms, changes of government, slow ethics board approvals, rerouted flights, slow global fund grant disbursements, and more, John relentlessly pushed for this study to continue. Julia Hasbun did the very hard work of leading 6 national teams, which had to pass the digital tablets they used to do the interviews from one country to the next because there weren't enough of them, a logistical hurdle. I heard about all of these challenges in our periodic interviews and by traveling to observe one arm of the study in Grenada, beautiful country, a country that has been multiply colonized in its history by Britain and France, and once previously invaded by my own country, the United States. A country, Grenada, deprioritized globally for aid because of small populations living with HIV, not cost effective, off the map of the global HIV response. In Grenada, I saw John and his partners work hard to rebuild dismantled trust. Local activists told me that the regional networks that were working with key populations had collapsed when PEPFAR abruptly withdrew funding from the region. They shut down their offices literally overnight, laid off staff, and, according to local activists, took all the programmatic data with them. What we might think of today as a violation of data sovereignty rights. So, as I describe in the book, John and others had to work very hard to win back the trust of local activists who are sustaining key populations outreach work with little or no funding as volunteers in Grenada. These activists were brought on board to the CVC study as partners, not low-paid data enumerators, but thought partners who strategized, rephrased questions in the questionnaire to make them sound more like local language, and worked hard to build the community trust and gather the data. These young Grenadian activists painstakingly rebuilt their networks, and they held socials, they held film screenings, they held barbecues, and they began to gradually scale up community-based HIV testing with men who have sex with men, some of the first time that that had been done in Grenada. Data, in other words, can be 2 things. It can be something extracted by a neo-colonial power to facilitate priorities set in Washington or Geneva, or it can be a real way to know thyself, as one activist said, to punch through the paper and see who's behind it, a local revelation, an organizing tool. The CVC study documented for the first time that there were transgender people in Grenada, that there were local sex workers in all their diversity, survivors of incest, and that there were profound and really urgent gaps in knowledge about HIV and safe sex among key populations. But as rich as this data is, you cannot read it right now because it has never been published. And so I call on the Organization of Eastern Caribbean States and its member states to please honor this award, honor the legacy of Dr. Robert Carr, publish the study, and use the data in it to fulfill the right to health for all. Henna Budwani, Rhea Harold, the team at UAB played a crucial role in advising and facilitating a rigorous, academically sound, civil society-led study. If you ask Henna, she will tell you the study was all John's work. And if you ask John, he will tell you that it was all Julia Hasbun. And a hallmark of a powerful collaboration like this, I think, is its humility. What I saw was a collaboration that was powerful because of that humility, because it crossed race, gender, class, and national lines, with a focus on the populations most vulnerable. And I salute the Global Fund for funding it, because what the Global Fund does at its best is to bring together government, civil society, academics, and other stakeholders at the same table as equal peers to work together for the health of all. And I hope that the fund will fund many more studies like this one. Congratulations to the transnational team of government officials, researchers, activists. Congratulations, John and Henna, for a breakthrough piece of work, which I hope will see print under your names. That would really be something to celebrate.
Meg, thanks much for your warm introduction and for being such a source of inspiration throughout the study in the Eastern Caribbean. literally becoming part of my long shadow at the end of a Grenadian day. Praise and recognition, of course, are always nice after a difficult task, but receiving this award today, named after the late Robert Carr, is especially gratifying and humbling. Doing a study like this reminds me of the saying that it takes a village to raise a child. Not that I have much child-raising experience myself, but it seems that it took various villages in 6 different islands to produce this child. Julia Hasbun, who also has no child-rearing experience, worked tirelessly in all of these villages and with the local teams and community leaders and national program staff, painstakingly collecting the data. Henna Backstop from Alabama and made some movie star appearances at critical moments, ironically precisely because she does have children to raise. And Ria, our very own demographer, crunched numbers and translated her work into tangible demographic data. Bullitt helped us think through some of the methodology, and we benefited from the vast research experience of not one, but 2 directors of the Sparkman Center for Global Health, Craig Wilson, the former director, and Janet Turan, the current director. Thanks to all of you, because without each and every one of you, this study simply would not have ever been possible. In the Caribbean, as in other developing regions, we are used to have external researchers parachute in, conduct research on community members, and depart without providing much information or assistance, and leaving community groups to mop up the mess. How do we overcome the bias that comes from approaching a community as an outsider? What social and cultural validity can a study have when it is conducted by outsiders who know little about the community, culture, and setting in which the research was done? We talk a lot about eliminating health disparities, but it seems that we make little progress. Surely a first step must be to enable communities to gain control over the determinants of their health. This involves engaging partners in ways that respect and fit with their contexts and realities. It involves democratizing the knowledge production process. It means bridging gaps between research and practice. Traditionally, research partnerships between CBOs and research institutions have been based on a single arrangement, where the research institute is responsible for the research protocol and for directing data collection and analysis, and the CBOs are basically relegated to providing access to target populations. However, there's strong rationale for us to rethink how we approach strategic information of research and collaborations. New trends and pressures have impacted both NGOs and academic institutions alike. Increasingly, NGOs are expected to demonstrate impact of their interventions and develop an evidence base for their work. At the same time, academics are being asked to demonstrate the usefulness and wider impact of their research on real-world issues and policy. These demands favor an environment to renegotiate research partnerships between academics and community groups. However, in reality, there are many questions that still need to be addressed about what each actor brings, what role each will play, and how the collaboration will work in practice. These include different priorities, schedules and capacity, hierarchies of knowledge and power relations. But it's best to have these things out in the open, because ignoring them can obstruct ways of working and limit the transformative potential of the partnerships. At CBC, we grapple with how to improve the development, implementation, and delivery of the programs and services we run. We are interested in knowledge that addresses the real-world needs of key populations, and in how we can then facilitate its translation into action in the form of practice, policy, or behavior that can bring about change in individuals, organizations, or systems. So we created the Robert Carr Center for Action Research Resources. The creation of a specialized unit within CVC provides a critical space to address and negotiate the differences between the assumptions and different knowledge that partners bring to the table. It provides an opportunity for CVC to create new kinds of research processes and outputs. And it draws on CVC's presence on the ground as a coalition with member organizations throughout the region, and on building research expertise in local members who have gained the trust and access to key population groups on the ground. This study on population size estimates in the Eastern Caribbean is a good example of what this new relationship can look like between community-based organizations and academic institutions. Traditionally, population size estimates have proved difficult to conduct, particularly in small island contexts, and as a result, frequently the data obtained has been questioned by community groups. Insufficient attention has perhaps been given to adapting the established population size estimate methodology developed in places like San Francisco to country contexts where the overall number of key populations are very much smaller and the behaviors are criminalized. This has led to population size estimates in regions like the Eastern Caribbean or the Pacific Islands being abandoned, or the results not being published or used. CVC and the University of Alabama at Birmingham have teamed up, each with specific roles and responsibilities. Although our overall approach in the OECS was based on tested and established population size estimate methods, we introduced specific critical adaptations and variations to address the small island contexts of the Eastern Caribbean. Understanding what modifications were made and why, and the impact they had in the results obtained, makes for a good case study in the importance of democratizing data. But this is really the subject of another conversation. Suffice to say that we came up with larger and more acceptable size estimates for each of the population groups in the 6 countries. We found new subgroups of MSM, trans women, and sex workers previously unknown or poorly characterized. We obtained greater buy-in of study results by community-based organizations doing frontline work with key populations in the OECS and the NAPS. We achieved substantial cost savings that allowed us to reprogram part of the population size estimate funds to other areas of the grant. We built the capacity of local organizations, strengthened community systems, and increased the regard for CBOs by the local authorities. Finally, by engaging countries and communities up front in the research planning process, we were able to achieve greater commitment to using the research findings for action. Key populations in the Caribbean face pervasive and persistent health and justice issues and should be entitled to excellent research. However, too often they have been subjected to extractive, irrelevant, and exploitative research, and when seeking out data, often find inferior quality products and services available to them. CVC and the University of Alabama at Birmingham have helped show that there is another way of doing things. By ensuring community groups are properly engaged in research processes, we can produce strategic information products that reflect the principles of accuracy, relevance, rigor, accessibility, and usefulness. Thank you very much.